Hello friends, I am Dr. Amit Miglani, Senior Gastroenterologist and Liver Specialist at Asian Institute of Medical Sciences, Faridabad. Today I am going to discuss about hepatitis, what is hepatitis, what are the causes of hepatitis and what are the symptoms of the hepatitis. Hepatitis, as its name suggests, hepat means liver, itis means inflammation. So hepatitis means that it is the inflammation of the liver. And what are the causes of the hepatitis? It can vary from viruses. There are numerous viruses which can put inflammation in the liver. Namely, there are hepatitis A, hepatitis B, hepatitis C, hepatitis E. Another condition is alcoholic hepatitis, in which if the patient is keep on consuming alcohol in large amount and especially in binge drinking, then it may lead to inflammation in the liver and which can lead to alcoholic hepatitis. Apart from alcoholic hepatitis, if the patient is obese and person is taking large amount of junk food on a regular basis, then it leads to deposition of fat in the liver, which we commonly call known as fatty liver. In later stages, it may also lead to inflammation of the liver, which we call NASH, that means non-alcoholic steatohepatitis. After that, there can be certain drugs which can cause inflammation in the liver, and rarely some autoimmune disorders also can lead to inflammation in the liver, which is called autoimmune hepatitis. Now, what are the symptoms of the hepatitis? In the initial stages of the hepatitis, there are usually non-specific symptoms like decrease in appetite, weakness, lethargy, malaise, which are very non-specific and does not direct to the liver pathology. Only in the later stages or the advanced stage, jaundice develops and the patient comes to know that patient is suffering from liver damage. So any patient suffering from non-specific symptoms must investigate for the liver dysfunction by getting some simple test called liver function test. Now, how to prevent this hepatitis? Among the viruses, we can easily prevent hepatitis A and E by always cleaning our hand before and taking any food, and always do not eat any unwashed food, and always drink clean drinking water. That is very important because hepatitis A and E is mainly transmitted through fecal-oral transmission. Among the prevention of hepatitis B and C, it is very important to have safe sex, and one most important thing is that now tattooing and body piercing is very common. Always use sterile needles because it can be transmitted from blood to blood. So always use sterile needles to prevent hepatitis B and C. For vaccination, hepatitis A and hepatitis B, vaccination is available, so you can prevent getting hepatitis A and B by getting vaccinated. Now I am going to tell you about what are the things liver like, so that you can prevent the inflammation or the damage to the liver. One should do regular exercise, and one should take balanced diet which contains sufficient amount of fibers and less amount of fat and less amount of carbohydrates. Apart from that, one should whoever drinks should drink in moderation only, and always use sterile needles whenever you are going to get for any tattooing and piercing. And apart from that, the most important thing is avoid over-the-counter drugs excessive use, because that may also lead to the liver damage. And in the last, vaccination is available for hepatitis B and A. Get vaccinated for hepatitis B. Thank you very much.